this video, I'm going to talk about tularemia, and tularemia is one of the many diseases that we characterize as zoonotic infections. Zoonotic infections, of course, from the word zoo, you can ascertain that it's referring to an animal vector. And in this case, we're talking about rabbits, and we're talking about deers. And the organism that's involved is very important to remember, and it's Francisella tularensis. So what's a typical scenario here? A typical scenario is you have either someone who is a hunter or a butcher or a farmer, somebody who deals with animals. It can sometimes be by accident, somebody who's not one of these, but generally speaking, one of these types of people. And what happens is the organism can cause this medical condition known as tularemia if the person either ingests contaminated food or water, or is bitten by the actual deer or tick, or if the person inhales the organism or has some sort of direct contact with the organism. Now, this Francisella tularensis is a bacillus organism. So that's basically the scenario. Now, when you develop tularemia, the history is probably the most important part of it, because the symptoms are so vague. The symptoms are, if I list them, headache, chills, nausea and vomiting, fever, they're so vague that this could be anything. So the most important part of diagnosing tularemia initially is the history. Talk to the person. Did you have any contact, any exposure? What do you do for a living? What's your occupation? Very difficult, I think, personally, because nobody really thinks about rabbits and deers when you're talking to somebody. I mean, generally speaking, unless you live in a environment that's very endemic to this. There is, fortunately, some symptoms or signs that are a little less general, and the one that really kind of stands out in clinical vignettes is a skin lesion. That at the site of exposure, they have a skin lesion, and that skin lesion is usually a papule, and it can sometimes be necrotic, where the skin is dying. Another thing that can happen with tularemia is the person can progress to pneumonia, with all the symptoms of pneumonia, which include shortness of breath. So that's the symptoms. Now, the diagnostic testing involves cultures and blood tests, serologic testing. And what's important to remember is that organism, I think I mentioned it, but it's basically a coxobacillus organism. Gram-negative coxobacillus. So that's what you're trying to find. So what's the treatment? Well, antibiotics are the treatments, and the most common drug of choice is streptomycin, and alternative is gentamicin. So I think the best thing to do is get right into some clinical vignettes. You can get an idea of what this is all about. So here we go. The day after hunting and skinning wild rabbits, a hunter develops an inflamed papule on one finger. The papule rapidly enlarges and then bursts, releasing pus and forming a clean ulcer cavity productive of thin colorless exudate. Several days later, the patient develops severe illness with atypical pneumonia and delirium. It is at this point that the patient seeks medical care. Regional lymph nodes of the axilla are enlarged, reduced breath sounds, rales, splenomegaly. Blood studies show a mild leukocytosis. Which of the following is most likely diagnosis? Well, as you can clearly see, lymphadenopathy and splenomegaly, and even the symptoms, are quite vague. But there's a couple things that stand out. The fact that he is a hunter who was handling wild rabbits, and he's got that papule on that one finger. So that points to E. Let's go to the next one. A 54-year-old truck driver collides with a deer on a highway. He takes the deer home and butchers it. 5 days later, he develops fever, non-productive cough, shortness of breath, and generalized lymphadenopathy. No skin lesions are noticed. What is his most likely diagnosis? Again, if you didn't have the history, you would just say, well, sounds like pneumonia or sounds like some infection. So very difficult. But the fact that fortunately, you took a history and he told you that, 5 days earlier I had this contact with this deer, that points to tularemia. Especially if it's in an area that's very endemic to this condition. And then finally, a 33-year-old man presents to the local clinic with fever, chills, headache, generalized myalgias, and arthralgias. Physical exam, there's an ulcer with a black base on his right hand and epitrochlear lymphadenopathy. Careful history reveals that the man is a hunter and a trapper, recently trapping and skinning rabbits. Which of the following organisms is most likely cause of this man's illness? Again, general symptoms, but a careful history. You revealed the most important point, that he's dealt with rabbits, and the organism is Francisella tularensis.